The following is brought to you by Vertical Vet. Rethink your GPO.
Hello again, I'm Dr. Ernie Ward, Executive Director of Education for Vertical Vet, and I am so pleased to have you joining us today because we're going to talk about a very important topic and one that is being talked about all around the country and arguably around the world, and that is the state of veterinary telemedicine. And today we've got an expert really about everything to do with the regulations. And so I've been eagerly anticipating this conversation to share with you guys because this is something that has tremendous impact on our profession and the way we interact with pet parents and our pet patients moving forward. And we really wanted to go to the source of regulations. And so today I am just thrilled to be joined by Jim Penrod, who is going to be representing the American Association of Veterinary State Boards. And that's really important because when it comes to regulating veterinary medicine, Jim, you're the guy. I mean,
Well, I appreciate that.
Yeah, but and again, guys, if you don't know who Jim Penrod is, I mean, he is an icon in the industry. I mean, he has done so much good for us. He's out there always fighting for the rights of practitioners. He's really doing things to protect the public safety in terms of veterinary medicine. So, Jim, again, I know people can look up your bio. It's quite impressive, but I just want to say, from a practitioner standpoint and somebody who's been a fan and admirer for many years, thank you for all you've done.
Oh, thank you very much. I appreciate that, Ernie.
Well, Jim, listen, let's just jump right into it because this is such a hot topic. And today we want to talk about, what vets can and cannot do when it comes to veterinary telemedicine, what we can expect as far as maybe potential changes. And I really want to also sort of talk about, how rapidly this space is growing and some of the ways that I think that the AAVSB can help us, I guess, keep things in check because, there are a lot of new faces, to say the least, in this space. There are a lot of companies and entities that, we've never seen before in veterinary medicine that are suddenly jumping on this bandwagon. And, I really appreciate people like you being our watchdogs and sort of helping us out. So to start things off, Jim, tell me right now, like as it stands today, where do most states lie when it comes to the practice of veterinary telemedicine? And you'll probably want to give a couple of definitions as we get started, I'm assuming.
Sure. And I think the biggest issue is around the VCPR, right? And whether or not that can be established remotely. And we've seen quite a few changes during the pandemic. Well, not a huge number, but 15 jurisdictions actually changed their regulations during the pandemic to allow the establishment of a VCPR remotely. Who knows where that'll go right after the pandemic's over? I don't know if they'll be rolled back or if things will just remain where they are. What we've seen, though, is we haven't seen a whole lot of complaints around telemedicine at this point. So I think that's a good, it sets the stage, I guess, for perhaps what's going to happen in the future.
And Jim, just real quick there, a lot of the states that enacted it, they did it in a temporary setting. So most of them are set to expire. In fact, several states are expiring as we record this webinar.
Yeah, probably.
Yeah, what do you see? I mean, do you think they're going to extend this? Because like you said, we haven't heard a lot of complaints nationwide or from the states. What do you anticipate? Are they going to, what's going to happen as far as, extending or changing?
Well, there's definitely a lot of discussion around it, right? I know there's been cases recently in Florida and Nevada. There's the Texas case about freedom of speech came back up, and there's a new one in California related to that. So, I think it's in demand. The public's demanding this, and we just have to see where it goes. But frankly, I think a lot of our member boards, our state boards, are talking about this and determining how they want to deal with it as they move forward.
Yeah, and Jim, also, I know that a lot of the state boards are looking to human telemedicine for guidance, and obviously they have a longer, deeper history with this. Maybe could you speak to some of the things that have worked in human telemedicine that you see maybe would also be translating to vet medicine?
Yeah, and I'll talk about both sides of that, right? Because there's some issues as well that I think are really important for us to consider in veterinary medicine. But on the good side, I think it broadens access to care, especially if you think about the folks that are, nowhere near a veterinarian or in a place where they can't bring their animal into the veterinarian. So I think it offers the ability to have that access to care. and cat owners in particular are probably looking for this as they move forward. The one area, though, where I think there's been some issues, and we've seen that in human medicine, is around the idea of undue influence. That you see some physicians that have started working for these companies that have an algorithm that really goes through some steps to determine a diagnosis that someone's trying to explain to them. And then, if they're working for a large company that may buy drugs in bulk, let's say, and then prescribe specific medications that are profitable for that particular organization. So I think in veterinary medicine, we got to be very careful that, the veterinarian is responsible for the choices here, and that there's no undue influence over their choices when they're looking at diagnosing, a patient.
Yeah, Jim, I'm really glad you brought that up because it has been discussed in human medicine, this undue influence. And,
Yeah.
most commonly it's linked to pharmaceutical sales, but obviously diagnostics and other things can be tied into that as well. And I think that this is one area where perhaps we can learn, from those maybe mistakes or missteps, because, we are less corporatized, if you will. We are more independently owned. So that is one benefit for veterinary medicine and telemedicine. But it is important because I have also heard talk about, insurance payouts. I mean, so there's a lot of linkages here between, like, when people are doing telemedicine, if the physician isn't being compensated, Jim, they aren't offering it. If they're being compensated,
Right.
they're offering it. So there's a lot of nuance to this. But aside from some of the potential economic influences, okay, what about just the quality of care aspect? I mean, I've seen different reports on where they've asked patients to rate a physician after telemedicine and vice versa. The doctor rated the telemedicine visit. What have you been hearing about that?
Yeah, and I think you're seeing a lot of teletriage companies out there now, which really is beneficial for the profession, I believe, because you're getting folks that are calling in with these questions that are easily answered, but they're calling a professional rather than looking up on Google or something like that, right? So they're getting some professional opinion, and whether or not they need to come into the veterinarian or not. And that's just beneficial in the long run to make sure that the animals are healthy. So I believe that in short term it's working out very well, and then in the long term I think we're just going to see more benefits.
Yeah, and again, there was a recent McKinsey survey of human physicians that practiced telemedicine during the pandemic, and they actually compared that to prior studies, and they found that, the vast majority of physicians said that they felt that telemedicine, and again, we'll say telehealth visits, teleconsults, I mean, not necessarily always diagnosing and prescribing, just interacting with
Right.
patients. They felt it was a positive influence on their patient care. And of course, the vast majority of patients felt like it was a positive as well. So Jim, again, getting back to the particulars of veterinary telemedicine, I mean, one of the things that we say clearly distinguishes us from human telemedicine is the fact that I can speak. I can say, it hurts right here, doctor, or, I think my throat is bothering me or have been chills, right? The dog, the cat, the animal can't speak for themselves. So talk to us about how that plays into your thought process when it comes to regulating telemedicine. Again, we're extending this by proxy. And one quick thing I'll just layer on additional complication is the fact that pediatric medicine was one of the first to really eagerly adopt, some telemedicine on the human side of things. So, it's a complex issue. But what do you see, the differences between dealing with an animal versus a human, even if it's a child, how does that impact telemedicine?
Yeah, definitely. When the AAVSB came out with some suggested guidelines for our members to consider as they talk about this issue back in 2018, and one of the things that was really critical to us is that the veterinarian is responsible for making those decisions and needs to have all the information available to make those decisions. And I think that there's probably less things that a veterinarian can do through telemedicine than a human physician can, right? But there's still many things that can be diagnosed virtually, and probably for the better, right? If you, as an example, if someone calls in and there's a kennel cough or something like that, you don't really want to bring that animal into the clinic and risk transmitting that disease to other animals around. So those things are easy to diagnose and get that covered and do a follow-up visit later just to see what happens.
Yeah, and Jim, I've long been an advocate. Again, everybody seems to make a big deal about the establishment of the VCPR virtually, and I agree that's an important aspect of this. But there are so many other things you can already do within an existing VCPR using telemedicine, and this is why as you know, I'm an eternal optimist. I'm very bullish and very enthusiastic about telemedicine. But if you're sitting there watching this today and you're worried about regulations in your state, if you already have an established client relationship, you should be looking at ways that you can enhance patient care, because as Jim just mentioned there, it could be an infectious disorder. For me, it's going to be a lot of behavior disorders and chronic pain management. And of course, nutrition and obesity is my passion, but all these things are perfect for a remote setting. So again, there are many differences. Jim, I appreciate you once again sort of reemphasizing that, we think there's a place for telemedicine, but it's probably not going to look the same as it does in human medicine. So we can't just draw direct parallels. Now, I'd also want to ask a little bit about this model guideline, because we look to you guys. Obviously, I was on the AVMA telemedicine committee. Those are just some very broad guidelines, and they have no regulatory impact. Whereas you guys, when you set up a telehealth model act, that is something that state veterinary medical boards can take and enact immediately if they choose, or whenever they choose to vote on it. So can you speak a little bit about what is happening with the Model Telehealth Act?
Yeah, and it took a couple of years to develop, right? Obviously, a big issue and something that our group of experts took a long time to really deliberate on and think about. And it came from the regulators. Our volunteers that worked on this issue were from the regulatory boards, and so I think they have the right perspective. But I think as states begin to talk about this issue, it's important to consider the guardrails around things, and that's what we tried to build into those model guidelines. Is that the doctor needs to be able to have the same information or enough information to make a determination of a diagnosis, and whether that's in person or virtual, it really shouldn't matter. The standard of care doesn't change, whether you're virtual or you're in front of the animal. So, I think it's something that can be served well, but boards really need to consider those guardrails as they move forward.
Okay, and that leads me, of course, to the most important question that's probably on the minds of everybody watching this tonight, and that's how do I avoid getting dinged, right? How do I avoid an infraction? So right now, what's your general advice to that veterinary professional out there who's saying, well, look, okay, Ernie, I know you keep talking about we should be doing certain things, but I don't know where the guardrails are. My state gives very little guidance, because let's face it, Jim, most of the state practice acts to date don't really encompass much telemedicine. It's very, very vague, if you will. So what's that general advice that you give that practitioner, out there watching today?
Yeah, and I believe that if you do have the VCPR in hand, that you can definitely practice telemedicine. Things that you mentioned, Ernie, are really good examples of where you could use it. Follow-up care, especially effective as well. So, avoiding discipline, though, I think it's really important, especially if you're thinking about establishing a VCPR remotely, is get some consent from the client, usually written consent. Put that in your medical records. Document everything in the medical records. If you're having video conversations or even text conversations with your client, make sure that all goes into the medical records. If there is a complaint, you need to be able to fall back on those things and be able to demonstrate to the board, to your peers, right, that you made the appropriate judgments.
Yeah, and Jim, one other thing too that I've really been emphasizing, and as a person who consults with a lot of different telemedicine companies or people interested in the space, it's really capturing also every bit of interaction. For me, Jim, I think one of the best defenses against a board act, and let's say I do get a complaint, is if I can show a video of exactly what transpired, and you can say, no, I didn't say that, or I did not prescribe that, or I did not make a diagnosis. Right. What do you think? That's one way to use technology to our advantage, right? To protect and shield us. What do you think about trying to record, capture, save as much interaction as possible? Is that going to help vets?
Oh, definitely. And I think that most of the issues that I've seen when I visited the state boards, when I'm visiting for their meetings, is really improper record keeping, right? So they look at medical records and they really don't, the doctors don't record everything that they've done. They don't record specific doses of medications and those kinds of things. And that's what gets them in the most trouble. That's the number one thing that we've seen as far as disciplinary actions, is when the medical records aren't up to snuff.
So, Jim, also one other quick regulatory issue. Like for me, one of the things that I had an issue with the AVMA when we were, and this was something I was very vocal about. I had a few dissenting opinions that were made public, but it was about who is responsible. So let's say that one of your clients goes and does telemedicine, teletriage, whatever. They do one of these 1-800 or online consultations. And let's say that a vet in another state, halfway across the country even, prescribes, diagnosis, does something that the client feels caused harm.
Right.
Where I've had a real issue is who is liable, how does liability work? So in that type of scenario, what is a vet, the vet of the patient, what do I do? Do I complain to my state? Do I complain to the state where I think the vet was? What do you recommend?
Yeah, and in our guidelines, what we talk about is that the veterinarian really needs to tell the client that they're licensed, where they're licensed, and make sure the client is informed about all those things, and what they can do if something does go wrong. If that's not the case, and if I'm a client and something does go wrong, I'm going to first look at where this veterinarian is licensed and go to that state, particularly if it's in the state where I reside or where my animal's been diagnosed. They should be licensed there, right? But I would go to that particular board and file a complaint, go to their website. The complaint forms are typically right there on the front of the website. Or you can go back to where they practice. And, many times a state board will take up a complaint based on that. If they're practicing, in a manner where they shouldn't be, especially if they're doing something out of state where they're not licensed.
Right. And again, this reciprocity issue is something that you guys are trying to get clear. I mean, there's a lot of, that is a very tangled web. I remember with the AVMA, because, there are some simple solutions and there's some very complicated solutions, but we need a solution, because what is going to happen, and this is, you've seen this to some extent in human medicine, although they have much better reciprocity nationwide, is that, people tend to practice telemedicine in states that are more lenient, that have less, oversight, if you will. So there are ways that we have to be cautious of. And that's why I'm glad to have people like you out there, Jim, because you are, you understand the full landscape of this. And again, this is one of those nice areas where, we always complain, Jim, about vet medicine's always 10 or 20 years behind human medicine. This is one of those times I'm kind of thankful for that, because we're learning, by watching them sort of stumble a bit here and there. But overall, I think it's a good thing. Now, Jim, crystal ball question, and you can refuse if you don't want to, but if you had to look in your crystal ball and you had to say, 5 years into the future, so let's now go to 2026, what do you think telemedicine and veterinary medicine looks like in 5 years from now, nationwide?
Yeah, I think there's still going to be some resistance in 5 years, but I do think that it's going to begin to take traction. For instance, Ontario started this about 4 or 5 years ago, and they're even allowed to prescribe right now through virtual visits. So I do think that's the trend, but I do think that there's currently a lot of resistance from the profession and really from regulators, because we haven't been able to identify what those guardrails are yet. And once we do that and get everything into place, then I do believe that the trend is going to be to move in that direction. With the shortage of veterinarians, the virtual care is really going to help hospitals out to be able to reach more patients. And as I mentioned, just for public protection or animal protection, access to care is broadly expanded when you can use telemedicine.
And Jim, just one other quick aside, because, obviously most of our audience is small animal, but large animal telemedicine has tremendous implications. You want to speak at all about that? Because I know there's an entirely separate set of criteria and regulations that are going on over there. Any just brief little insight into kind of, what's happening in food production, for example?
Well, definitely. I've seen some presentations where they're talking about using drones and things over herds and that kind of thing, just to maintain herd health, that kind of thing. So I think it's there now, and the one concern that I have looking forward in large animal medicine is really thinking about the prescribing issue. And again, back to my point that the veterinarian needs to have no undue influence and be able to make the appropriate decisions. And we don't want corporations prescribing medications when the veterinarian needs to be involved.
Yeah, that's a really, really good point. I appreciate you reminding us of that. Jim, again, as we kind of wrap up today's conversation, because there's a lot to unpack and there's still a lot of uncertainty. If you're talking right now to, veterinarians who are saying, okay, look, I get the teletriage and I'm using that to help me with my after hours calls, for example. As I keep saying, these new teletriage things, it's like the beeper or the pager version 2. If you and I are of a certain vintage, we carried a pager. We know what a beeper sounds like.
Right.
I still have PTSD from that tone, Jim. but so everybody accepts that, and I think within reasonable boundaries, that seems to be helping us out. But I think again, what's that? They're now struggling to say, okay, look, Ernie is saying this one thing, and I'm hearing Jim say another, thing that sounds supportive. If they've got a VCPR, can you just once and for all, please just reassure them that it's okay to do these calls, especially I think the follow-up care is where we're missing so many opportunities. I mean, whether it's managing chronic pain or, as I mentioned, behavior and nutrition. I mean, even ears. I mean, we're having people take pictures of the ear canal in dogs for follow-ups. I mean, is that not the low-hanging fruit? I just keep saying it.
Yeah. Yeah, I agree, Ernie. I think that if you do have a VCPR, then it's, especially follow-up care, I think that makes a lot of sense. If the patient presents a new issue, then I think I'd bring them back to the office at this point. But there's definitely a lot of things that you can do virtually, especially in follow-up, and small things, as you mentioned, fleas and those kinds of things that easy diagnosis without having to bring the animal into the clinic.
And again, with the crunch that we're hearing all across the country, I'm just trying to look at ways to improve efficiencies. And, I've been saying this since, last February, March, when all this pandemic began, because it's like, hey guys, right now you're going to be shut down and all this stuff. At least you can, do these simple things with your clients. And I like also that you mentioned some of the derm cases, because we've also seen great success, especially, I'm in the South, and you're in the Midwest, so it's summertime and there's a whole lot of flea allergy dermatitis, so when, if I don't have the capacity to see them, I think again, a video consult with an existing client makes a lot of sense. And let's face it, Jim, a lot of times these are patients that we've seen year in and year out for a decade, and every June, July, August or whatever, the fleas, and so I love that you brought that up. All right. Any last bit of advice before I know you've got to go, but any last bits of advice for vets out there that are, just curious or concerned about telemedicine in general?
No, I definitely think that, the state laws and regulations are all there on their websites. It's important to take a look at that, make sure you're familiar with that, especially if you're practicing in a new place and you're not familiar with the state law or their regulations. Really good to do that. Also, look at some of the studies around, what you just mentioned about dermatology. There was a study in the UK that really looked at dogs and virtual diagnosis of dermatology cases, and with a really high correlation to those that came in clinic. So I definitely think there's information out there and a lot of good case studies about how you could use virtual care and make it work for you.
Yeah, and Jim, just to piggyback on the UK study, if you didn't see it, also a huge paper dropped from was it from Google? They've been working with the dermatology team to do artificial intelligence interpretation of images. So, I mean, there's just, this thing is happening so quickly. And again, there are some great use cases. There's some things I think you and I would 100% be enthusiastic about. And then there's other areas where you and I would be like a little reticent to say, let's go all in veterinary medicine, because it is a little different. Well, Jim, I can't thank you enough. I've been so looking forward to this conversation. I like not only all the things that you do outside of this particular issue is helping us, but more importantly, you also understand, you know, the promise of telemedicine, but you also understand some of the risk. And so I think you've taken a very measured approach. And again, I just really appreciate your leadership the past few years, particularly on this issue. So thank you again.
I appreciate that, Ernie. Thank you.
All right, and we'll have links everywhere, you know, so if you want to find out more information, definitely check out your state board and what they have to say or not about telemedicine regulation in your state. Again, I want to thank AirVet for sponsoring this. This was an amazing conversation. Jim Penrod from the American Association of Veterinary State Boards. I mean, this guy is right on top of it. And I hope that you've learned a little bit about, you know, the state of telemedicine regulation, but also I hope you understand that we have got a really great team of people sort of overseeing this on a nationwide level, just like Jim. So again, thank you to AirVet and thank you to Jim Penrod for joining us today. And again, as always, thank you Vertical Vet and Vertical Vet members for spending some time with us. As always, I am Dr. Ernie Ward, Executive Director of Education, and we can't wait to talk to you soon. Bye.